There is a stunning and heartbreaking statistic these days, and that is 2,500 kids today will try a prescription pill for the very first time. It upsets me beyond anything else. And I just have to wonder, how did we get here?
Yeah, it's mind-boggling. And we're talking about children. Our children will try 2,500 a day, will try a prescription pill to get high. I think partially, we live in a chemical culture. We live in a culture where the answer is, if you have a headache, take a pill, take an extra strength pill. If you get your wisdom teeth out, here's some opiates. Here's 75, 80, 90 opiates. It's pills have been thrown at everything.
They've been normalized.
And the drinking, if you're having a good time, you'll have a better time. You can go to the lake with your friends, but boy, if you can have beer with that, then you'll really have more fun. You'll be sexier. You'll be funnier. It's a very chemical culture. So I think that's part of it. And then there's also that excess. We all know the opiate epidemic stems from reckless prescribing, opiate messaging that was given by Big Pharma that was incorrect. So kids are literally going into their parents' and their grandparents' medicine cabinets and taking pills. They'll even have parties where they come and they just dump all the pills in a bowl and take whatever's in there. So you might get an Oxycontin or you might get a thyroid med. And they don't know that's part of it. They call it farm parties.
So it's like Russian roulette with pills. And it's happening younger and younger, is it not? I mean, the average age of first use of anything is 12.
12. So that means some a little later and some a lot younger.
Some younger.
And I'm seeing more and more clients who've started at 7, 8, 9, and it's either opening up grandma's nightstand and there's cocaine in there, or their parents are letting them have a marijuana gummy bear with them, or they're smoking weed with their parents, or they're having a drink. So more and more it's happening in the home.
How important is it for the entire family to understand the realities of substance use disorder in this day and age, especially when we're talking about fentanyl and a little drop of fentanyl, you're dead?
I think it's important for everybody to understand. Siblings, aunts, uncles, grandparents, none of us want to think it's our kid. So we've said, it's not my kid. It doesn't happen at this school. It doesn't happen in our community. It doesn't happen over in our place of worship. And so we professionals have not done a good job of helping educate our communities on what addiction is, what the signs and symptoms are, what it looks like, and really helping people understand that it happens to everyone across socioeconomic, across racial barriers, cross-culturally. It happens to everyone.
I guess it's natural for parents to want to think, this is not my kid.
There are a lot of stigmas and there are a lot of stereotypes that get in the way. So first off, no one wants it to be their kid because they think, oh, that only happens to the bad kids or those people on the other side of the tracks. The other thing is that there are a lot of misconceptions about what substance use disorder looks like. People think you have to be homeless, you have to use 24 hours a day, you go into withdrawal, you have to be older, non-functional. And so we've not done a good job of helping educate families and parents about here's what it looks like. It looks very different in a teenager than it does in a 60-year-old. Teenagers don't use as frequently, but when they do, they use larger amounts. So it's more deadly, more reckless. But again, I think you're absolutely right. Parents don't know exactly what it is they're looking for.
It's the truth of the matter that parents really don't understand this disease, and that's why they don't talk about it or they don't want to talk about it.
We have to start early. We have to start having these discussions with our kids around the dining room table at a young age. If you wait till they're 12 or 13, it's too late. The average age of first use is 12. So we've got to start early. I mean, I talk a lot about how even in our school systems, we have fire drills, we have tornado drills, and God forbid we have active shooter drills today. But where are our addiction drills? Because addiction is more likely to kill our children than a fire or a tornado.
That is a sobering thing to hear. What do we, as a national community, as a country, what do we need to do to keep our kids safe?
We've got to educate ourselves. We've got to educate our communities about substance use disorder, fentanyl, overdosing. We've got to educate about what it looks like. We've got to help our children know what the signs and symptoms are and that it's not a disgrace to have this illness. Our families, our loved ones, the communities need to know that here's what it looks like, and you can ask for help and get help. Our kids need to learn about it so they can talk about it when their friends start using and they get scared. They need to be able to see it within themselves. We need to have the kind of response that we've had for other difficulties that we've had in life, like the pandemic, like terrorism. So we've got to have town hall meetings. We've got to stay informed. We've got to educate. We've got to really look at helping build and put together more brick and mortar treatment resources for families out there, because there's a huge lack in the ability of our families and people who struggle with this illness to get help.
And that's why we built this platform.
Yeah.
That's why we Hear It Real brought in some of the finest people in the country to talk about this, to provide information and resources and help, because it's not okay that our kids are dropping dead every day when it's preventable.
That's right. So I'm a hostage negotiator. And in the hostage negotiation field, there's a term that I think is so applicable to the substance use field, and that is that there are 0 acceptable losses. And that's how it's got to be. I mean, we have all kinds of evidence-based treatment. We know more about the parts of brain affected than we've ever known. It's the only illness where you can have it and your life can be even better than before you had it. So for most illnesses, you have it and you get back to that baseline. But this is an illness where you can actually flourish because you have better coping skills, better connections, great support systems out there, and you can have a life better from having this illness than not having had it.
Something remarkable about you, Heather, is that not only have you been in this business for a long time, but you've also been in continuous recovery for 40 years.
I really started to show the signs and symptoms. I mean, I would have met full criteria for diagnosis at 16 years old. And yet I didn't get into treatment until I was 21. I got kicked out of school. I had multiple car accidents. I was obnoxious. I was like the loudest one, foul-mouthed, rude, and I'm Southern. It just doesn't fit in well. I ran away from home. I ran away from home for 6 months, went off to University of Georgia, had a 1.19 average because I went to the wrong class. And when I went, it wasn't that often, So, I mean, I was a mess. I was a real train wreck. I did end up asking for help, but it was because I had gotten so sick and tired. I mean, I would go out. I would say I was going to only use so much. I'd use more than I did. I'd throw up. So one night I finally just declared to everybody, that's it, I'm going to rehab. When I had run away from home, there was a psychologist that my parents had me go see. I didn't know he was also in recovery. And so he had planted some really good seeds along the way. So he's the one I called.
And then you went to rehab?
I went to rehab, and I was the youngest one there. I was 21, just turned. And it was a program that treated addicted physicians and nurses and medical professionals, which I was not. So I was really case building about there's been a very grave mistake made here. I really don't belong here. But I'll tell you what happened a couple weeks in. The beauty of the program I was at was, because it was 1982, there was a doctor there who was one of the few around the country who were beginning to talk about it being an illness and a disease. Now, when you're studying psychology and you're using cocaine and you're paranoid and you think that people are trying to get you and everything, it's really easy to go through your textbook and diagnose yourself with every disorder. It's really a bad combination.
Oh, I'm sure.
So I was so relieved to begin to hear and understand that what was wrong with me was that I had an illness. And back then we called it chemical dependency. And everything started to make more sense. And I got hope that I could get better. So I started thinking more clearly and seeing more clearly. But the very first family session I had with my parents when I was in treatment, I said to them, why didn't you do something earlier? There were so many signs along the way. Like, why did I have to ask for this? I mean, I was really upset.
Once a child starts using and there's no early intervention, is that child doomed?
What we know is that there's some kids that can use, and for whatever reason, they corral it in, it doesn't become excessive, and they don't develop substance use disorder. But what we do know is that the younger you use, and if you abuse, the more likely you are to develop it. So kids who are starting at 12, if they abuse substances, and there's some other risk factors in there as well, but that they're more likely if they don't have some kind of intervention, some delay, because you're pouring drugs and alcohol on top of an immature, undeveloped brain full of hormones. So it can really stop the growth emotionally. It can come in and it can really cause a lot of cognitive deficits. The good news is the brain isn't done growing until now they're saying 25. And so if you help someone stop, the brain can repair itself as well.
The brain does repair itself. And I guess that is the good news in this. Do you find that more often than not, parents minimize their child's drug use?
Absolutely. Absolutely. I had a family, and this was probably 12 years ago, came into my office and sat down, and their son was 17. They said he has been on methadone for 2 years, which means he got addicted enough before he was 15 on opiates to be on methadone. He had had 2 trips to the hospital for overdosing and the damage it had done to the liver from the pills he was taking, the prescription pills he was buying. He had had 3 accidents and had been arrested twice. And they said to me, we don't really think it's that bad, and he's promised us he'll stop. So I went through and said to them, let me go through everything you just said.
And when you read back the list of the DUIs and the hospitalizations and the this, that, and the other thing, did they hear you?
They heard me, and yet, I think they were scared. I mean, I think for parents.
Well, yeah, they should have been scared.
They should have been. I don't think they were scared for the right. They were scared if we do something, maybe he's not going to like it. I think it'll be too much. What are the neighbors going to think? They're all, maybe they hadn't looked at their own relationship with substances that was getting in the way. But yes, parents tend to minimize. Sometimes because they've only seen that little bit, that tip of the iceberg. Other times because not my kid. I don't want it to be my kid. I can't believe it's my kid.
Is that minimizing really denial?
Yes, it is. Denial is a way we come in and we just really say there's not a problem here. We want to make everything better. The energy behind denial is fierce protection. I want to make sure you don't hurt. I don't want you to suffer. I'm going to do everything I can to make you okay. But what happens with substance use disorder is it doesn't play by the rules. It's not fair. So the things parents come in and do end up actually making it worse. So I think if we help parents say, look, denial is fierce protection. Let's take that protective energy and we're going to push you outside of your comfort zone to do some things that you're going to be really uncomfortable with, but they're going to support your child's health and they're going to be much more effective at helping them get into recovery and feeling better.
You have said that parents should ask this question and use it as their North Star. Does this support my child's health, or does it contribute to their demise? That's powerful.
It is powerful. And it's a decision tree that all family members need to really work from. If I have a child who all their life has dreamed of going off to college, and yet 16, 17 years old, I see serious signs of substance use, grades dropping, changing of friends, and I send them to college without any treatment. Does that support their health? Or does that contribute to their demise?
That seems like an easy answer.
Yeah. And yet if I'm a parent and I love my child and I know how much they want to go off and I know how much they want to be in the same graduating, their friends have all just graduated. They want the same freshman year. It's going to hurt my heart to say, you're not ready to go yet. We've got to go get help.
Right.
But if I don't, I'm going to send them off to an environment loaded with drugs and alcohol.
Where they could die. So often the puzzle pieces don't come together when it comes to family. And you've said that's because the teenager involved can split the parents, meaning pit the parents against each other. So how do parents begin to be aligned so that the child can't split them?
Right. Kids are masterful, even without substance use disorder, at giving little pieces of information. And the next thing you know, mom and dad are having an argument over who said who could do what. And the kid's on the way out the door doing, getting into trouble. So it's really important that parents communicate and get on the same page. But to do that around substance use, you have to know what the page even looks like. You have to have an understanding of what are the realities of substance use. It's a different world. The drugs are contaminated. They're full of fentanyl. We have deaths every day of teenagers who've used a pill for the second time, third time ever. They wouldn't even meet the classification of substance use disorder. So parents have got to really learn, what does it look like? How is it, that we can both be united and have the same morals, the same values that keep our child safe?
And it's hard when you're not on the same page as your spouse or partner or your former spouse, right? Do you find that at first the parents may be arguing a lot over it and then they become more aligned as they realize the seriousness of the situation?
It depends. For some parents, they can both see the signs and symptoms, especially when you get into things like legal issues, trouble at school, some of the more blatant issues. Sometimes there's philosophical differences around, can my son smoke pot at home or not? Am I okay with that? But often, particularly as the illness progresses, parents will come together and get on the same page. But not all the time. And sometimes you'll have a very permissive parent, a parent who doesn't want to address it, has difficulty talking about it, and that can make it hard. It can be a death sentence.
And so what do you recommend for parents who really cannot seem to get on the same page? What are some simple things that parents can do?
Well, educate yourself. Understand what substance use disorder looks like. Understand what the signs and symptoms are. And also educate yourself around, what is it like in a family system? Like, what are the rules that happen? And then get some professional help. If two parents are on such different sides of the continuum, permissive, absolutely not, go and get some help. Let the experts do an assessment, do an evaluation, and give you some tools on where you're at and how to manage that.
And I would assume having a talk about what the family values are, and then how can we make collective decisions that are going to benefit our child?
Right. Absolutely. That's right. Because overall, we want our kids to flourish. We want them to be happy, and we want them to be safe.
Let me ask you about something called tough love. What does tough love mean to you?
So tough love, to me, has very harsh connotations. And I really believe if tough love were going to truly have worked, we would have cured addiction back in the 80s when it was so big. So tough love means cut your kid off, throw them out on the street, disconnect with them. Now, I work with plenty of families where their young adult is so disruptive because of their substance use or behavioral issues that they really are a hazard in the home to the younger children. They're bringing drugs in the house. And they say, we can't have him live here any longer or her live here any longer. And it's appropriate for them to say, okay, you can't live here. If you don't go get help, you can't do it under our roof. But to just kick someone out because you think that's going to be what helps, often it's not. Sometimes there are other issues. There are mental health issues. A child's under 18. Again, the boundaries have got to make sense. They've got to really, like we talk about, the punishment has got to fit the crime, even though it's not a punishment. The boundaries got to fit the situation. It's got to make sense, and there's got to be a learning in there for it. So again, does it support health? Again, if I've got a child living in my home that steals out of my wallet at night when I'm asleep and goes and buys drugs, and I've done everything I can do within my home to try and stop that, short of or maybe even sleeping with my purse under my pillow, and I don't want my kid to use my money to buy drugs, that may be an answer. You can't live here. But tough love was really a movement of it's the consequences, it's punishment that's going to make someone go and get help.
So let's talk more about boundaries. Are boundaries one of the most important pieces of the puzzle?
They are a very big, important piece of the puzzle. Boundaries help individuals to know what to expect. They help them to know where I end and where you begin. Boundaries keep me safe. Boundaries keep you safe. Boundaries really come in and define how we act as a family, what we believe in. So if you've got a kid who uses and brings illegal drugs into the home and then is explosive and yelling and verbally abusive, but we come from a family where we don't yell at each other, we don't call names, that's not in our moral compass. And again, that's broken. And boundaries that we have in our home teach our children how they're going to be treated out in the world. So if my boundaries at home say you don't have any rules or consequences and you can have any kind of behavior you want, and then you take that out into the real world, if it's okay for you to break things in my home, eventually you're going to go break things out in the world and then you're going to get arrested. So it's my responsibility as a parent to have boundaries that will really mirror real life and give those tools to go out and live.
You have said that setting boundaries is like physical therapy. It doesn't feel good while you're doing it. It might actually hurt while you're doing it, but it is necessary in order to get better and to get stronger.
That's right. Boundaries, again, they're things that we have to do as parents when we have a kid with substance use disorder that they hurt. We're outside of our comfort zone. We don't want to disappoint. We don't want our kids to feel pain. But there are things that we do that may hurt in the moment, like saying no. But if we don't say no, it's going to be harmful in the long run.
And there are all different kinds of boundaries, right? There are physical, emotional, financial. Could you speak to that?
Absolutely. So there are all different categories of boundaries. Emotional, which are how you treat me and how that affects my emotion. Whether you're verbally abusive, how you speak to me, whether I'm up worrying about you all night long because you won't follow the household rules and come home at curfew time. That's emotionally straining. Financial boundaries, constantly spending money, needing money. And what parents often, if I asked a parent, would you buy your kids drugs? They would immediately say no.
Yeah.
But parents are very susceptible to manipulation because they love their kids.
And you want to believe the best about your child.
You want to believe the best. And when you have substance use disorder in your home, your brain chemistry becomes impaired as well. So you're not thinking clearly. You're not making the best decisions. You're making emotional decisions in the moment.
How do you set reasonable boundaries? Boundaries that are based on honest conversations with your child and with your partner. How do you do it?
Well, I think part of it is really sitting down first with your partner, because the adults in the family really need to come to terms with what they're both in agreement of, and looking at, what are the boundaries that we have around safety, around emotional safety, physical safety, financial safety, getting clear on that, and then talking to your children about that. And really saying, we have a no use policy, period. And if you get caught using, we're going to go for an evaluation. My kids know that if at any given time, if I suspect something, they may have to go for a drug test.
But you have to stick to it, right?
Right. Kids learn really early. Years ago when we started drug testing, I had kids that would go, okay, fine, take me for a test. And their parents would go, oh, okay, well, I don't have to now because they said they'd go do it.
They were preemptive
so
about it.
They learned, right,
Yeah,
right.
What do unhealthy boundaries look like?
So unhealthy boundaries are inconsistent. They're changing all the time. They allow for use in the home. They allow a person to be violated in some way. Let me give you some examples. I've had clients where it's not uncommon that their teenager blows up puts holes in the wall, walks off in the middle of conversation with parents, refuses to follow the curfew, steals out of their siblings' room or their piggy bank. Those are unhealthy boundaries. So they've got to make sense, but they're about helping promote, like our job, to get our kids to keep them safe, keep them healthy, and to really help them to figure out what is your purpose? How do you give meaning to your life? To educate them, to give them the opportunities that they need and that they deserve so that they can go into the adult world.
It seems to me that ultimately setting boundaries is an act of love and an act of respect.
It's an act of love. It's an act of respect. And your kids want to know. They want to know what the boundaries are. They really do want boundaries that are there and that are held. If you haven't been good at setting them and they change a lot, then they're going to fight you on that. Teenagers really want their parents to be consistent with their boundaries. That's how they feel safe.
Is it appropriate for the child to have boundaries with the parent? And what do those look like?
In the household, there needs to be mutual respect. One of the things that you can't do as parents is have the old do as I say, not as I do. And where parents will have boundaries, kids need to have boundaries too. They need to have privacy. And yet parents also need to be aware and check and be sure that they're not on social media sites that they shouldn't be, or in dangerous places like on the dark web. So again, those are all discussions that families need to have. But children have rights too, and they have rights to boundaries as well. I think part of what happens is when those boundaries get broken, like if a kid is locking himself in the room and smoking marijuana or self-harming, then parents have to really talk about, is it safe to let my child have a lock on their door or not?
What are a couple of examples of healthy boundaries that the child can set?
The child can set healthy boundaries by saying things like, it's not okay for you to yell at me or call me names. We need to have discussions. You can't talk about the other parent to me. You can't use pejorative language. I need to be able to have a certain amount of time where I can have my privacy.
Including, there may be times where I'm going to close my door. Doesn't necessarily mean that I'm using drugs.
That's right. That's right. I think you have to be aware. If your child has a history of using or locking themselves in their room and doing things that go against the household rules, then it changes. Then you have to touch base. I think a lot of it has to do with communication. But what's important is to really get professional help and guidance. There's no one set list of rules or boundaries for any one family.
Let me turn to expectations.
Yes.
We have a saying in recovery that expectations are premeditated resentment. Is it even safe to have expectations when it comes to your child and substance abuse?
Well, you can have reasonable expectations for your kids. I think part of what gets our kids into using substances is that some of the expectations are so big. That your child's going to get a perfect score on the SAT, that they're going to be an athlete, that they're going to play whatever their sport is, and they're going to do it before school, after school. Some of the pressures are huge. And so when it comes to substance use in your kids, particularly if you have a kid in treatment, healthy expectations are things like, we as a family are all going to follow the treatment professional's recommendations. And that's our expectation. I'm not going to make a decision about your treatment. You're not going to make a decision about your treatment. Uncle Joe's not going to make a decision about your treatment. We're going to let the professionals do that. But I think we have to be careful to not have unrealistic expectations either, because that's where you get into resentment. And unrealistic expectations might be that everybody's going to come up with a boundary and hold them perfectly.
How important is it to differentiate between your expectations as the parents and their realistic goals?
That takes a lot of conversation and a lot of getting to know your kids. It's so important to listen to your kids, to have those discussions, to let them be unique. You may be the kind of parent where you grew up adoring sports. There's nothing you want more than your kid to play sports, and they may be extremely artistic. Embrace their inner artist. Don't cloak them with what you want them to be. Ask them who they are, listen to them, and then help them to be who they are. Families really do have to almost deconstruct how they communicate and how they connect to be able to connect in a healthier way. So if a parent is struggling with how they're interacting with their child, they're not sure of what the boundaries should be, whether they're using or not, that's stressful. And so it's important for parents. You can't go too early to get your own help. And help can look a lot of different ways. It can be going to a support group. It can be going to Al-Anon, Families Anonymous, Nar-Anon. It can be going to a counselor. It can be going and seeing an addictionologist to get a consult. But you can't start too early.